The results of a long-awaited cell phone study are in. The study looked at whether people who use cell phones frequently have a higher chance of getting cancerous brain tumors. Now, this study was done in Europe, Israel, Japan, and spots throughout the world. And what they found is that overall, there was not a link between cell phones and cancer. However, when you looked at one specific type of brain tumors called gliomas, they did find that there was a link. The folks who used their cell phones the most had a 40% increased chance of getting a glioma. Now, one thing to point out here is that this finding was statistically significant, but barely. And here's what the cell phone industry had to say. They said, the Interphone study authors stated that there were suggestions of an increased risk of glioma at the highest exposure levels, but biases and errors prevent a causal connection. And indeed, many scientists, even those not connected with the cell phone industry, say that this study has its problems and is not definitive. So the bottom line of this study is that there may be a connection between one type of brain tumor and cell phone usage. However, more research needs to be done. So what are we supposed to do while scientists are doing that research? What you can do is use an earpiece, either a wired one or a Bluetooth one, or you could also use a speakerphone, anything that will keep some distance between you and the cell phone, because the phone does emit radiation, and a lot of scientists are concerned about that. Now, researchers hope that the next step is to study children. Some children are using cell phones at very young ages, and really no research has been done to see what the effect is on cell phones on developing brain tissue. Back to you.